This video talks about the wrist joint. We will look at the type of the joint, the articulating bones, supporting ligaments, movements, and finally its neurovasculature and anatomical relations. Let me select the module of the wrist joint to better see its structures. The wrist joint is also called the radiocarpal joint, and it is a synovial ellipsoid or condyloid joint. In an ellipsoid joint, an oval convex articular surface fits into an elliptical concave articular surface. The wrist joint is formed by the distal end of the radius and the articular disc from above, and the scaphoid, lunate, and triquetral from below. It's important to know that the ulna does not contribute to forming the wrist joint. It articulates with a radius superior to the wrist at the distal radio-ulnar joint. The articular surfaces are covered by hyaline cartilage, and the capsule encloses the joint and attaches to the radius and ulna proximally and to the proximal row of carpal bones distally. The capsule is lined internally by a synovial membrane that attaches to the margins of the articular surfaces. The joint cavity is separated from the cavities of the distal radio-ulnar and intercarpal joints. The wrist joint is mainly stabilized and strengthened by 4 ligament groups. These are the palmar radiocarpal ligaments, the dorsal radiocarpal ligaments, the medial or ulnar collateral ligament, and the lateral or radial collateral ligament. The palmar radiocarpal ligaments are situated in the palmar aspect of the wrist, extending from the styloid process of the radius to the carpal bones. These ligaments are the radioscaphocapitate, the long radiolunate, the short radiolunate, and the radiotriquetral ligaments. The dorsal radiocarpal ligaments lie dorsally and extend from the dorsal tubercle of the radius to the carpal bones. Their main function is to limit the full flexion of the wrist. The ulnar and radial collateral ligaments extend from the styloid process of the radius and ulna to the adjacent carpal bones. They are responsible for stabilizing the medial and lateral aspects of the wrist joint. Ellipsoid joints allow movement along 2 planes, the median sagittal plane and the horizontal or transverse plane. The movements that occur at the wrist joint include flexion, and extension, as well as abduction and adduction. Flexion is tilting the hand toward the palm, or moving the palm towards the forearm, and it's mainly performed by flexor carpi radialis, flexor carpi ulnaris, and palmaris longus, with some assistance from flexor digitorum superficialis, flexor digitorum profundus, and flexor pollicis longus. Extension is tilting the hand toward the dorsum of the hand, and it is mainly performed by extensor carpi radialis longus, extensor carpi radialis brevis, and extensor carpi ulnaris, with some assistance from extensor digitorum, extensor indicis, extensor digiti minimi, and extensor pollicis longus. Abduction is performed by flexor carpi radialis, abductor pollicis longus, extensor carpi radialis longus, and extensor carpi radialis brevis, whereas adduction is performed by flexor carpi ulnaris and extensor carpi ulnaris. Moving on to the innervation and blood supply of the wrist joint. The wrist joint is mainly innervated by branches of 3 nerves: the anterior interosseous branch of the median nerve, the deep branch of the ulnar nerve, and the posterior interosseous branch of the radial nerve. The blood supply to the wrist is delivered via branches of the dorsal and palmocarpal arches that form through the radial and ulnar arteries. You can check our video on the blood vessels of the hand for more information. Finally, let's look at the important relations of the wrist joint. The joint is related anteriorly to the tendons of flexor pollicis longus, flexor carpi radialis, flexor digitorum superficialis, flexor digitorum profundus, flexor carpi ulnaris, and the median and ulnar nerves. Posteriorly, it's related to the tendons of abductor pollicis longus, extensor pollicis brevis, extensor carpi radialis longus, extensor carpi radialis brevis, extensor pollicis longus, extensor digitorum, extensor indicis, extensor digiti minimi, and extensor carpi ulnaris. The wrist is related medially to the dorsal branch of the ulnar nerve and laterally to the radial artery.